Hey guys, Caitlin here with the AAFE. Here I am doing some talks on this patient. As you can see, I marked those lateral borders of that temporalis, and now I'm evenly spacing dots across the frontalis of where I would like to inject. I like to mark those lateral borders of the frontalis almost bordering that temporal fusion line to ensure that I do not spock the patient's brows. Once I have that first line of landmarks drawn, I like to have my patient raise up again, and I would like to go in between the dots that I just created in order to get a nice even diffusion of toxin across the whole entire upper half of that frontalis. Moving on to the glabella, I'm having her make an angry face for me. This patient has been treated with toxin repetitively, so I know her true anatomy is not shining through right now just because she does get it done every 3 months. So something that I like to ensure that I'm not going to drop a brow is do a 3-point injection in that area to ensure that I am not injecting too deep on those lateral corrugators. I'm also doing crow's feet. I'm having the patient smile really big in order to mark those. And with these masseters, I'm drawing a line from the corner of the mouth to the base of that tragus, and then I'm drawing a line for those anterior and posterior borders of the masseter and clenching to confirm where I'd like those injection spots to be inside that box. That way I'm confirming where I am going to inject, and I have an accurate representation of where is safe to inject. Here I am now injecting that frontalis, so I'm starting over at that lateral border of that frontalis and working my way over. It is half needle depth at a 45-degree angle. So as you can see, I'm approaching every injection with the same angle. It is blebbing a little bit, which is completely okay. I always tell my patient those little blebs and those red marks are going to go away within the next hour or two. Always make sure that you're moving from side to side of your patient or adjusting your injection techniques so it is comfortable to you. I usually move sides of the bed, or I have my patient turn towards me in order to make sure that I am injecting them at a safe and comfortable angle for me. Next, we're moving on to the glabella complex. So here I am injecting that procerus at a 90-degree angle, 3/4 needle depth. And then I am doing those medial corrugators, which are true 3/4 depth on those. And I like to do those at a 45-degree angle. And I'm making sure I'm tenting up tissue so I'm not getting diffusion to the brow. Next, I'm doing crow's feet. These are very superficial. So as you can see, I'm just inserting the bleb of my needle. So it's usually a quarter of that needle and it's very superficial. I want these injection sites to bleb like a TB test. So I'm very superficial. You can see the outline of my needle underneath her tissue, which is completely normal. Same thing on the other side. I'm making sure I'm going up towards the eye, pulling that tissue taut, in order to make sure that it's easier for my needle to go in with the least amount of resistance. And I'm just working around that orbital rim. Here I am confirming once again that I like my injection sites for those masseters. I do a 2 to 3 point injection on all my masseters just to prevent a fish gill and to make sure that I get a nice even diffusion through all of that masseter muscle. So if someone has a really tight masseter, sometimes that toxin doesn't really not want to necessarily diffuse through it. So I just do a couple more injection sites to make sure that I'm getting more diffusion than if I were just to do one. Moving on to that temporalis, I always scrub that hairline with alcohol, and then I place my finger there and have my patient clench their teeth to confirm where I would like to go. As you can see that area contract very nicely, and that is a good indicator of that is the bulk of the muscle. That is where I'd like to inject. So as you can see, it's the same angle as that frontalis, 45-degree angle back and up into that hairline, making sure that we're not too anterior so we don't hit that frontalis.